Welcome everyone to today's webinar. I am Brian Zimmerman with Becker's Hospital Review. We'll begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Q&A and clicking send. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. In about a week following the webinar, we will be sending all registrants a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Jessica Silvestri has been with Cardinal Health for over 10 years. Starting her career in operations, she now works on pre-source procedural kitting products and services. Jessica has over 7 years of experience working with various customers and systems and partnering with a variety of facilities, including standalones and one of the top 10 IDNs in the US. She has supported over 15 custom procedure pack assessments along with standardization products within medical surgical commodities, as well as 2 involving case pick standardization. Her projects have focused on SKU reduction, custom pack standardization, and clinical practice changes through product standardization. Jessica has served on the CEO Advisory Council and President's Advisory Council, as well as participated in a variety of Kaizen projects and McKinsey-led engagements. Kelly McRory is the Director for Clinical Strategic Sourcing for Jefferson Health in Philadelphia. She is responsible for overseeing $500 million in clinical supply spend for the health system. Kelly has worked for Jefferson for the past 13 years, and during her time there, she has been an integral member of the Value Analysis Committee and works to support the hospital's evidence-based medicine model. Kelly is the current president for the local AHRMM chapter, CPAC. For the 5 years prior to being elected president, she also had held the vice president position and served on the board of directors. She also holds positions with National AHRMM, serving as a member of their Speakers Bureau, as well as a former committee member of the Chapter Relations Committee. In 2018, Kelly was named one of the top 10 women in healthcare supply chain in the country. Now, before we turn the floor over to Jessica, I'll share some background about Cardinal Health. With more than 40 years of experience, Cardinal Health is a recognized leader in transforming the healthcare supply chain for hospitals and health systems nationwide. Cardinal Health provides medical supplies and services to more than 85% of U.S. hospitals. The company has been ranked by Gartner as one of the top 3 companies for healthcare supply chain excellence each year from 2013 to 2017. In 2018, Cardinal Health was honored to be named Gartner's first ever healthcare supply chain master's class in recognition of continued excellence. Now, to lead our discussion of clinical standardization, I'll turn it over to Jessica Silvestri of Cardinal Health.
Thank you, Brian. Hello and welcome, everyone. Thank you for joining us today. We're going to discuss how hospitals and health systems can create and implement a clinical standardization strategy, but in particular, we'll focus on 4 objectives. First, what is clinical standardization? Second, what are the benefits for hospitals and health systems? Third, once you've determined to standardize your facilities, where do you begin? And finally, we'll discuss 4 ways to achieve success via a real-world example in action, Jefferson Health. To discuss how they developed this 4-part plan, we'll hear from Kelly McRory. But first, let's get started by defining what clinical standardization is. As the drive for value-based care continues in hospitals across America, the need and request for standardization has become a very common theme. It has proven best practice to support clinical outcomes, safety, improve efficiency, and control costs. The key to success with standardization is data analytics that identify products and services to help ensure quality care while lowering costs at the same time. It's important to note that there's no one-size-fits-all solution. It can mean different things to different people, and there are 5 major reasons why hospitals and health systems choose to standardize. First, to save money by converting to lower cost products. Second, to lower expenses by reducing waste. Third, increase efficiency by standardizing common products across an entire hospital or system. Fourth, to make life easier in the OR with efficient procedure packs. And fifth, to focus on a holistic approach to savings and efficiency by standardizing and integrating clinical and supply chain practices. In every case, the strategy should be based on individual goals of the hospital or health system. But above all, it requires the buy-in of key stakeholders, including clinicians, to succeed. There are two levels of clinical standardization, product and process. So let's go ahead and take a look at both. Product standardization yields new efficiencies as well as cost savings. Using common products and procedure kit componentry enables the provider to leverage volume purchasing power and potentially earn more advantageous rebate tiers, all of which can lead to lower product costs. This also decreases SKU count, minimizes waste, and reduces inventory on the shelf, which improves efficiency and contributes to cost savings. The second, which is process standardization, has many advantages as well. It removes variation and creates one simplified approach across multiple settings. The more standardized a clinical process becomes, the easier it is to implement. Because it's repetitive, it's simpler to learn and pinpoint outliers, as well as provide guardrails on which practices to avoid. This makes day-to-day implementation much more predictable. Creating one simplified approach across multiple clinicians in different settings allows for less time spent managing products and processes and more time focused on patient care. In addition, a commitment to operational excellence and such principles as Lean Six Sigma creates an environment of continuous improvement. While these two levels can be independent of each other, they're more often directly aligned. And this is particularly true when the goal is to standardize across an entire health system. So let's move on to the benefits. The five major benefits of clinical standardization are: first, supporting patient safety; second, reducing waste and driving down procedural costs; third, improving workflows; fourth, gaining operational clarity; and fifth, it frees up more time for patient care. So let's go on to each benefit and discuss in more detail. In my experience, clinical standardization helps hospitals and health systems support their patient safety initiatives in two ways. First, it minimizes the risk of doing patient harm by helping to keep expired products away from them. It also helps reduce product expirations by streamlining inventory management, keeping fewer products on the shelf, and increasing inventory velocity and turnover rates. The second way it supports patient safety is by reducing the potential for error by standardizing clinical processes. I mentioned this earlier, but it's really worth reinforcing that because it's repetitive, it's simpler to learn and pinpoint outliers, as well as provide guardrails on which practices to avoid. That makes day-to-day implementation far more predictable and helps avoid variation that can lead to mistakes which might impact patient care. So let's talk about the second benefit: reducing waste. Clinical standardization reduces waste and drives down procedure costs. To begin with, it greatly improves operational productivity because it reduces your SKU count and requires your supply chain team to manage fewer products. It will also enhance clinical productivity because there's less inventory on the shelf and less variation among products. Clinicians spend less time searching for those products. I mentioned already that clinical standardization helps hospitals and health systems with their efforts to drive down procedure costs. A key way it results in savings is by aggregating that volume to fewer vendors, decreasing inventory levels, and minimizing holding costs. Let's turn our attention now to the third benefit, which is improving workflows. Clinical standardization improves operational and clinical workflows in several ways. It streamlines supply management by reducing product variation. With fewer types of each product to manage, supply chain professionals have more time for other tasks, such as supporting the hospital or health system's patient safety and quality of care goals. Simplified ordering and product management is also achieved. Because there are fewer products on the shelf, it naturally takes less time to maintain the appropriate inventory levels. Other improvements include reducing stockouts and helping ensure supply continuity in two ways. First, by improving inventory visibility, and second, by concentrating supply orders among fewer vendors. And for supply chain professionals, there's an added benefit of increasing speed of workflows and driving throughput. Lastly, it supports clinical efficiency as well by reducing process variation. And I've already discussed how increasing repetition can not only improve efficiency, but also support patient safety goals. Now let's talk about the fourth benefit, which is helping you gain operational clarity. Clinical standardization can increase supply chain visibility, which can give you operational clarity to improve decisions made around supplies. So for example, it can simplify operations for clinicians through standardizing to one process for each type of task or one product for each type of commodity or clinical need. It also simplifies operations for materials management. Again, because there are fewer products, it takes less time to manage them. It also frees up more time to focus on discovering innovative new products because supply chain professionals have fewer products overall to manage. And as a result, they can seek out new innovations that can support patient safety or quality outcome goals. Lastly, there is an improvement in supply decisions that are based on objective data and analytics. It takes the support of clinical leadership to make any standardization initiative successful. And when you're able to give them full visibility into efficiency and savings opportunities, you'll have greater buy-in and support from day one. Our fifth and final benefit supports your hospital or health system's quality of care goals by freeing up more time for patient care. So how does clinical standardization give you back more time to focus on patients? First, it reduces the effort spent on purchasing decisions, inventory management, and training. By streamlining these processes and making them more efficient, you can free up significant time for other efforts. Next, it'll define clinical, individual, and supply management roles. When everyone is clear on how they support more efficient supply management, the more successful your standardization efforts will become. It takes strong and consistent collaboration between clinical and supply chain teams to make these types of initiatives work. And when it does, the rewards are great. And shortly, we'll hear from Kelly as she shares the Jefferson Health story in a minute. Perhaps most important of all, a joint effort between clinical and supply chain teams to standardize increases the sense of pride and ownership. Cardinal Health recently conducted a survey of clinicians and supply chain professionals to gain their thoughts on how they could work better together to create a clinically integrated supply chain. In that survey, 42% of surgeons and nurses said, quote, saving money helps all of us. 77% said that the same or even better care was possible while reducing costs at the same time. And 77% of OR clinicians said that they want more input into inventory management decisions. So clearly, from the survey, the desire among clinicians to participate is there. So this gets us to, where do you begin? First, you're going to want to define your clinical standardization strategy. And what I've seen work best over the years and have learned is to outline what the process looks like, and particularly who needs to be involved. This would include the process, who's involved, the makeup of the team. It'll vary from hospital to hospital, but identifying who will lead the initiative is key to success. Next, setting expectations. This is another really critical step for clinical standardization from the absolute get-go. It's around setting expectations, keeping open line of communication with both internal and external teams. Who are the point people for the initiative, and what resources and educations are needed in order to ensure that the initiative is successful? I have also seen plans to mitigate potential risks, particularly with product categories where sensitivity is high, such as physician preference items or custom packs. This is extremely helpful to discuss at the onset of a project. in the event an obstacle arises. Next, there needs to be a strong focus on stakeholder buy-in. Cost pressures are significant, and the state of flux that caregivers experience during product changes is real, and the impact it can have on patient care is very real. It can impact both operational and clinical workflows, so having buy-in from key stakeholders is critical. Over the years, the number of projects I've been involved with, time and time again, having buy-in from both caregivers and physicians proved to be a fundamental part of standardizations which were successful long-term. The other thing that I'll add here is around starting small. And depending on the product or process, it can be very helpful to begin with a small team, a service line, or a specific facility that will serve as the clinical voice and ultimately champion the initiative. This ties right back into stakeholder buy-in that I just mentioned. For example, starting small became a very real driver of success when I worked on a bone cement conversion, a product with moderate to high clinical preference rating. The customer determined a trial period would be done by a select handful of physicians with the objective of getting them on board and supportive of taking that value to their own peers. By validating the clinical acceptance of the product first by a small group, it then reinforced the initiative to standardize because the hospital was able to state there was clinical support, then followed by financial savings. The last part that I'll walk through here is the use of data and analytics to demonstrate value. Where applicable, the use of data analytics is key to the why and the why now aspects of clinical standardization. Directionally, we know healthcare is moving into data and analytics. The scope is very wide, including data related to outcomes, procedural costs, and benchmarking, all of which are valuable tools for standardization. They empower both the supply chain team and caregivers to understand the full potential of each opportunity and make informed decisions regarding product choices and changes. To share the 4 ways clinical standardization has succeeded at Jefferson Health, I'd like to now introduce Kelly McRory, the Director of Clinical Strategic Sourcing. Kelly, do you want to take it from here?
Absolutely. Thank you so much, Jessica. That was really great information. Hello, everyone. As Jessica mentioned, I'm Kelly McRory. I'm the Director for Clinical Strategic Sourcing at Jefferson Health. I'm here to discuss the importance of clinical standardization in helping you achieve supply chain goals such as reducing costs, improving efficiencies, and freeing up more resources to dedicate and improve patient care. In particular, I'm going to share how Jefferson Health has collaborated with Cardinal Health specifically over the past 4 years to succeed our clinical standardization initiatives. This collaboration has helped us to achieve aggressive goals, including standardizing major product lines, creating new supply chain efficiencies, and delivering substantial financial value. That's a great example of our win-win relationship. We both have skin in the game, and together we continue to support Jefferson Health's vision of delivering exceptional care while controlling costs at the same time. So what makes our collaboration work so well? I think it can be addressed by sharing 4 ways to achieve that success. The 4 ways to achieve success are collaborating with a strong vendor, choosing the right vendor, overcoming your challenges, and leveraging best practice. So let's get started with the first point, collaborating with a strong vendor. I guess the first question for some of our organizations is this something you need to do? If you're a large organization or a small organization, I think this is a question that you should be asking yourselves. So to begin with, Jefferson Health is a rapidly growing IDN in the Philadelphia area. In fact, we've grown from 4 to 14 acute facilities, soon to be 17 in just a short period of time of under 4 years. Our continued expansion creates a significant amount of complexity and potential inefficiencies that can cost us real money. But to this point, where do you begin? So we really want to standardize clinical products across the breadth of our facilities and help centralize spend and achieve both cost control and quality care initiatives. To support and help accelerate our success, we need to collaborate with a strong vendor. So we answered that question out of the gate pretty quickly. Once we saw how rapidly our organization was growing, we knew this was a direction we could go into. So we want to generate a greater value from a single large vendor with deep resources. So this is all about maximizing economies of scale. When you can consolidate your spend under a single vendor with multiple GPO relationships, deep breadth of product line, and strong distribution, you'll generate a greater financial value. Those dollars can be reallocated to improving that patient care. So let's talk about that GPO relationship a little bit that I touched on. I think we all have a lot of competing priorities in the supply chain area. Jessica mentioned them a little bit, but if you're in a larger organization or an organization in a growth mode, or even an organization that may be acquired by a larger organization, those GPO alignments are very important, and how you work to maximize that relationship. So looking at the contracts that your GPO provide versus where you are aligning with your vendor is very important. So the next point is drive standardization and SKU reduction across multiple locations. We want to increase utilization of fewer SKUs across every site of care. Jessica made this point several times in her presentation. Your vendor needs to help scale, needs that scale to help you accomplish that. So Jessica did that with custom packs in the example that she had shown. And that's what you want to do. You want to make sure that you're not just going ahead and saying, hey, it doesn't matter who you use, or what you use, I should say, it matters only who you use. We want to make sure we do both. It's who you use and what within that bucket you're going to use across the enterprise. And then we talk about GPO again, reducing the contract variation. So, you know, when we started our mergers, everybody was on a disparate GPO, and it was very difficult trying to align our standardization. So getting that done out of the gate was really key. And then aligning that vendor to look at the programs and rebates across the GPO is very important. Then we want to promote the consistency of education and care everywhere. So not only is it SKU reduction like we talked about, but that consistency of education, where you are reducing your SKUs, where you are providing education, consistent education to your clinicians, that equals a better patient outcome. It equals clinician satisfaction, and it's really going to ultimately provide a better outcome for your patient. So once everybody is on board, they're more willing to embrace the program. But you need a larger vendor who's not going to just sell you a product and walk away to accomplish this. They're going to be there with the support that you need and how you need it to accomplish your goals. We also want to rely on a single source to solve supply chain issues. So now more than ever, and I use the example of the hurricane season, I guess it was a year or so ago, where it was the perfect storm, pardon the pun, where we had several hurricanes. Puerto Rico, as an example, was very difficult for us to get past because of all of the manufacturing plants that were in Puerto Rico from a medical supply perspective. We're not saying that choosing one large vendor is going to mitigate that type of situation happening again. We cannot control those types of things. But the good news is there are backups on backups. If you're looking at the breadth of product line from large vendor, they're not just going to sell you the only, urinal. I'll use that since they went on back order. They're going to have other options for you. They're going to have other suppliers for you, and they're going to help keep your supply chain healthy, which is so important, making sure that you have what you need, that your clinicians have what they need to care for the patients. And it is a quality product at that. Next slide. So how do we choose the right vendor? Now that we know that there's value with a strong vendor, let's figure out how we choose the right one for your organization. So you want to make sure that the vendor that you choose offers dedicated education teams, not just a salesperson. We don't want them to come in, again, to my point, and drop the product and walk away. We want to make sure that if we have needs in our organization, and I'll use Example Loves as an example, it was our sacred cow, so to speak. It was one of those things that in our organization, due to an exposure in the 90s, everybody was very fearful of ever changing from the vendor that we needed. But we made sure that we partnered with Cardinal, and we told them these are our expectations for education, these are our expectations for even testing before we got to that point. And that partner was ready to stand up and take that challenge on. And ultimately, we were able to break the sacred cow, and we were able to convert exam gloves across every single acute and non-acute site in our organization with, I'd say, a little bit of handholding. Let's go to drives the right GPO contracting agreements. So we're not always going to have 100% alignment between our GPO and our stronger vendor partners, but you want to make sure you're not picking a partner that has little to no GPO footprint, because that's really going to kind of split your loyalty, so to speak. We want to make sure that if we're enrolling in a highly committed program with our GPO, that there is an alignment. We also want to make sure that it's not just a one and done. If we see the history of how these contracts are awarded, what is your position of the vendor partner that you're kind of looking for? Has their position been strong? Has it not been? Do you find that some of your GPO counterparts actually take opt-outs on their highly committed because they love the product so much they really don't want that change? If that's the case, these are the decisions we have to make when we're looking at for that partner. And then when they maintain a wide breadth of product lines to mitigate backorders. So we're talking about that healthy supply chain again. Do they have one urinal, or do they have 15 options for a urinal? Do they have other manufacturing plants, or do they just have the one? These are things that are very important when you're getting into a long-term agreement with a vendor. And then we really wanted, at Jefferson Health specifically, to provide a single point of contact to handle issues. I know I myself, as the director of clinical, if I get an issue, it bubbles up to me. I don't want to make 15 phone calls. I want to make one. I don't want to hear how the problem is solved. Maybe I do, but for the most part, I want that person to I want it all to be transparent to me. I want that one point of contact to go out, get the answers, find the solution, engage the folks that are going to make that solution a reality, and it comes back to me as completed without getting all the nitty-gritty 15 different emails back and forth. I don't think any of us in healthcare have time for that type of back and forth. So knowing that I can call one person to handle my issue is very, very important. And that person knows who our organization is. So the next point is we really wanted someone who could share the financial risk long-term. So what does that mean, really? Share the financial risk. Doesn't mean that we only pay half. It just means that there is a value to that financial success moving forward. And we look at it category by category, and they're really willing to understand that we're not going to make a move for the same amount of spend and clinical equivalency. We really want to make sure that when we're switching products out, there's either an improvement to patient care at the same cost or an equivalence of patient care at a lower cost. And I think if your vendor understands that and what you're trying to accomplish, it's going to make that relationship so much better. Another thing that I think is super important is that your vendor sees the big picture. It's not just about the transaction, the next contract addendum, or the next product line. It is really about who we are as an organization and who the vendor is as an organization, where they're going, where we're going, where is their synergy, where is the alignment, so we can really look at things in the short term and in the long term. So I'll use Cardinal Health as the example, obviously, but they've gone through a number of mergers and a lot of growth in the past couple of years. And what's interesting is in our weekly meetings, we discuss what's coming next. We look at what those product lines are, and we start to manage how we're going to tackle them, or if we're going to tackle them. So that big picture for new opportunities to save is huge, especially being a large growing IDN, because for those facilities for which we do not have a presence or can talk about, we may have signed a letter of intent, but we are not in there and we're not permitted yet to talk about, what they're using. Those vendor reps really know what's going on in those locations. And while they can't share it with us yet, they're coming up with a plan in advance. They're always thinking ahead of, are they using, what kind of gloves are they using? Maybe this is an opportunity. What kind of topical skin adhesive are they using? They know, they understand. They get us 5 steps ahead of any integration So on day one, when we're ready to share information, they already have a game plan to talk to us about and figure out where we're going to approach the standardization out of the gate. Helps us a lot. So we're starting at step 5 and not step 1. So step 3 is overcoming your challenges. If we could advance to the next slide. Thank you. So we want to make sure that when we choose the right vendor, what can they do for us to help overcome our challenges? And what could those challenges be? So the first one, and my least favorite, is overcoming clinical resistance to standardization. So I mentioned this earlier, and you likely know from your own experiences, change can be hard. This is particularly true when your goal is to standardize clinical products. Clinicians are scientists, so they need hard data as proof that converting to a new product is in the best interest of the provider and the patient alike. That is why it's so important that a vendor has a clinical team that can work directly with yours to support standardization. And we talk about change fatigue, which we'll talk about in a second, but the clinical resistance is something I say it's my least favorite. And even though I say clinicians are scientists, sometimes they're very passionate. All the time they're very passionate, not as scientific as I'd like them to be. I've heard words like wonky to describe reason that they can't use certain products. It's difficult, it's clunky. These are not scientific terms. This makes it extremely difficult for us to look and try to pinpoint where there are challenges. I can't scientifically quantify why a product is wonky. So, having that vendor to be able to say, how do we get past that? What are the true scientific issues and how can we help you do that? And Jessica had mentioned it's not a one size fits all, but what we have to keep in mind, and we really need to reiterate with our clinicians, that quality and safety are a supply chain initiative. And once we work with the clinicians to have them understand we're not just trying to put in a lesser product or a value product, we're all trying to achieve that value. I think overcoming that clinical resistance to standardization will happen, and it'll be much easier. And for us at Jefferson, these issues happen on a day-to-day basis. We could have something work perfectly fine in 12 of our hospitals and have for years, and in our 13th hospital, all of a sudden there's patients that are having reaction to something. Why is this happening? We really need that vendor to go ahead and roll up their sleeves and get in and figure out what are they doing. So we use topical skin adhesive. Everybody's been using it, no issues. All of a sudden we have patient reactions in one place. What is different about that location? Are they using a different prep that's causing these types of reactions? And a stronger vendor is going to be able to come in and help you take care of that. So let's talk about that change fatigue. Again, I've mentioned Jefferson Health and their growth, and depending on where you are in the country and where, if it's the larger fish gobbling up the smaller fish in the hospital, not everybody is going to want to change, certainly not change often. So the joke that I've always said with mergers and acquisitions in healthcare in the Northeast is a little bit like dating in your late 30s. It's no longer about who's attractive, it's more about who's available. So you're not always going to get the most financially advantageous organizations under your umbrella out of the gate. So the financial pressures are huge. Day one, CFO, beating down your door, save, save, save. We have to turn this hospital around. And that means a lot of change very rapidly. So we have to manage change fatigue. So a key to our success is working with our standardization vendor to consistently introduce and communicate the value of our formulary across the health system. We really have to manage that change. So, we look to the first point about overcoming clinical resistance. If we set it right the first time and we are empathetic to the clinicians and we let them know, look, we're here for you, we're reiterating the quality, we're reiterating safety, we're reassuring them that this is going to be painful. And what I find so interesting, it's not about the product. I think that is lost in translation a lot of times. It isn't about the product, it's more about the change and managing that change. So it's also communicating with the clinicians after a product recall or failure. Now, I would say failure with air quotes, because I think that is that wonky statement I made earlier. Not every product conversion is going to be flawless, but as any product, you can have issues. It's how you handle them that will make the difference with clinicians, how you work together with your vendor and communicate the best course of action moving forward. The right vendor can thoroughly investigate the issue and help you build the best course of action. Instead of pivoting away from your goals, you're actually going to charge forward toward your goals. Like Jessica said, the clinical team and the supply chain team working together will equal the success. So I'm going to add to that and say it's the clinical team, the supply chain team, and a strong vendor that equal that success. And then achieving the true best value possible versus nickel and diming. So I made this statement before. That vendor needs to understand we are not going to make a change unless there's significant clinical value or equivalent clinical outcomes at a better cost. So it all comes down to the strength of the vendor relationship. Are you working together to create a long-term value, or are you transactional in your relationship and nickel and diming every single product line? Jefferson Health and Cardinal Health have created a relationship where we generate that long-term value for both of us. Next slide. So what are our key takeaways from our success with clinical standardization? What are the best practices you can use to help guide your own program? Touched on it before, deep resources plus a strong relationship equal the best value. I've been talking about this from the beginning, but it bears repeating. The success of your clinical standardization efforts will rely in large part on choosing a vendor with deep resources and the commitment to collaborate with you over the long term. That is the key to maximizing financial value. It is also critically important for clinical success. Needs, incentive to help motivate change. So these are absolutely essential to help you get the price you need to be successful. What are our incentives to make this change? What is the value of the change for us? What is the cost of change? We can't necessarily change everything at the same time. So what is our motivation to do so? Maybe it's that new hospital that came on board who is upside down financially, where we need to help them out quickly. You know, what can we do? What is the incentive there? And making sure we communicate that incentive across the continuum of care. And then efficacious clinical products are key. If you want to create financial value while at the same time not give the impression that you're converting to a less than premium product, the quality has to be there. And we have been successful in accomplishing this. The depth of the product line is essential to maintain a healthy supply chain. You don't want your product conversions to result in stockouts or other issues, especially for some of our really, really large IDNs in the country that are looking to make these types of changes. If there is not enough product in the pipeline, we have to be careful. We saw it a couple years ago with a very large, at the time, a custom pack, not Cardinal, vendor, where the supply was just too much. They had signed on a significant health partner, and it put a strain on that supply chain. Those are the types of things that should never happen. And when you pick the right partner, those things should not happen. And then how issues are resolved defines the strength and the value of the relationship. I think one way to start chipping away at the foundation of a relationship is when something is dismissed by a vendor. If they say it's not a big deal, or other places are doing it, I don't know why you can't. That's the first way to start chipping away at the relationship. There needs to be empathy, listening, and a solution right in line with what we're trying to accomplish. And then complete and open transparency is mandatory to achieve mutual success. So I've saved the most important point for last: a strong vendor relationship that is built on trust. You want that vendor to go to bat for you. You want them to see that big picture and work side by side with you to achieve your long-term goals. Total transparency is the foundation of the relationship with Cardinal Health. Clinical standardization is a process, and together Jefferson Health and Cardinal Health will continue to work together to create new value that benefits us both. So how have these best practices worked at Jefferson Health? Let's take a look. The numbers speak for themselves. We standardized 8 major product lines from 3 vendors to 1, and they're not the easiest things to change. Jessica mentioned her work on custom procedure trays, never an easy task. Freight management, surgeon's gloves, exam gloves. We definitely did not wait to tackle the more difficult product lines. Topical skin adhesives, infection control apparel, surgical drapes and gowns. We created new efficiencies. The SKU reduction alone, the vendor management, the ease of vendor management. We streamline our customer service, and in the result of that is we created supply chain efficiencies. So over the past 4 years, we collaborated closely and met our aggressive goals related to standardizing major product lines and creating new efficiencies. And frankly, Jessica touched on it briefly, but that introduction of one product that meets the needs of clinicians across the care continuum really does free up the clinicians to focus on patient care. There's a lot of schools of thought around streamlining different things, and even with regards to your dress every day at work. If you wear a similar outfit every single day and change it up only slightly, that's one less decision you have to make. So think of it from a clinician in a critical situation. They don't want to have to think about which one of the 5 items that we've given them to choose from they're going to pull for their surgeon or for their clinician. They don't have to make that decision. They don't have to think about it. That can be freed up for them to be a better diagnostician. That's our job in supply chain and with a strong vendor partner to give that up for them and make sure we're working together to put the right product into their hands. Next slide. So achieving success with clinical standardization and clinical products to meet your needs with the supply chain, focus on 4 ways. We're going to collaborate with a strong vendor. You need to make that decision right out of the gate. Choose the right vendor. It's not going to be a short-term relationship. So I always joke and I say when we're looking for that strong vendor, we want to make sure they understand that we might be dating, but once we make that commitment, we're in a long-term relationship and the party's over. The courting better continue. We still better get flowers every week. And then we need to work with the vendor to overcome our challenges and leverage our best practice for success. Cardinal Health collaborated closely with Jefferson Health to help define and implement our standardization strategy. You'll want to tailor your own strategy to meet your hospital or system-specific needs. To define that strategy, the 4 ways I've outlined here are a great place to start. Now, I would like to turn this over to Brian for the Q&A portion of this program.
Thank you, Kelly and Jessica, for that fantastic presentation. Attendees, please remember to take a moment to complete the survey that will pop up as you close today's webinar. Your feedback is invaluable to helping us continually improve the value you receive from discussions such as this one. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We'll try to get through as many questions as we have time for. We've had a bunch of great questions coming in, and I think we'll get started with this one. Kelly, it might be a good one for you to take. So how do you justify the cost when requesting funds for standardization projects?
So when we justify, I'm going to answer this the way I think the person asking the question is looking for an answer. But when we're requesting funds for standardization projects, I think the cost for us is really in the conversion of any products or SKU reduction. So the example that I think of when I'm looking at the justification of the cost of conversion is something as complex as, let's say, hand sanitizer. So I mentioned it in the presentation that, it can't be every single product line that Cardinal has to offer that we'd say, oh yeah, we want to do that right away. If it's difficult, if it's not difficult, if the return is small, we have to really look at it and make some really hard decisions on whether or not that cost of conversion is worth it. So if we look at something like a hand sanitizer, let's say we could save a couple $1,000s, but the return for us is really almost in the negative, because not only are we just going to save a little bit of money, but now we have to involve multiple departments. We have to shut down rooms over periods of time so we can go ahead and change the hardware out. It's not worth that. The funds just really aren't there. The savings isn't there. But when you look at something a little less, multidisciplinary, it doesn't cross a lot of departments. There's not a lot of effort into it. You're really going to want to look at those things, because those costs are really the savings and the value that you're going to bring forth. It kind of far exceeds any of the cost to us for conversion. So there is always a cost of conversion. and that's where we look to our vendors to kind of bear the cost, especially from an education perspective, on that at least, so it's not as labor intense on our side. But that's how we justify what projects we look at, is really that delta between the cost of conversion versus just, ease of conversion.
Thank you, Kelly. And Jessica, I think this next one would be great for you to answer. So what are some tips to overcoming roadblocks with clinical staff?
That is a great question, and something that I think Kelly did a great job as it relates to mentioning some of this earlier. I think, the position of the vendor is the biggest thing that we can help in terms of roadblocks is by being present, accessible, and responsive. These initiatives are huge, and being present, I mean everything from education to in-servicing, and I mean in-servicing, night shift, weekend shift. Taking care of the clinicians during that period is really crucial, and it's about listening and getting at the why for them, which, 99.99% of the time for them, it's going to come back to providing the best patient care possible. And if you're there to support that need through that standardization effort and that product, that's how I think you can, best overcome those roadblocks.
Thank you, Jessica. And Kelly, we'll move back to you for this one. So how do you engage staff to participate in standardization projects? Any specific methods?
So outside of the value analysis process, where that's a little more rigid and there are folks that have been assigned by their departments, my sourcing team works hard before a project ever gets to value analysis to engage clinicians to make sure that we're getting, the right product in front of the value analysis team. So, it goes back to what Jessica said, what I've said, which is the clinical team, engaging them, letting them understand that supply chain does care about quality. Supply chain does care about patient outcome. We're all trying to make our organizations, better. We're all trying to get our patients the best experience possible, and getting them excited about the change, if that's possible. I don't know, if I look at a 30-year veteran nurse, they're not always excited about things, but to get them excited about the fact that there's a possibility that they're going to deliver patient care, or their life is going to be made easier by, a product that's easier to use. Or the third piece of it is trying to, if those two things may not be applicable, but getting them engaged, because what we don't want them to feel is that they didn't have a say in the process. Now, it's a little bit like the tail wagging the dog. I think there are ways to go about it, we never ask the question, well, how do you like something? It's more about, how was the feel? Is it clinically acceptable? So you really have to manage that piece of it. But having them understand that if they don't get involved, decisions could be made without them. And the folks that we have, that we do pull in may not be the right people, and they're not going to have a say. So I think it's level setting, getting them excited, and making sure they understand that we all have the same ultimate goal, and we can work together to achieve that.
Thank you, Kelly. And Jessica, do you want to weigh in here? Perhaps you can touch on some engagement methods that you've seen in your standardization projects as well.
Yeah, absolutely. I would completely echo what Kelly just said around getting the right folks involved at the beginning so that they feel that their voice is heard in the process. It makes me think of an example. I had a 15-hospital system that tackled a project to standardize to a single C-section pack, and it was executed, probably from my perspective, almost perfectly. They had representatives from each of their 15 facilities present to walk through every component in that pack so that each site felt that they had buy-in, they had ownership, and when everyone walked away from that meeting, the playing field was level. Everyone knew what to expect moving forward, what the process was going to be. And if they did encounter, situations where they felt like, oh, I really want this 2-ounce med cup, or I want this 4-ounce, specimen container, they worked through those things and got down to an agreed upon formulary for that pack, and everyone walked away knowing what the future held for that kit. So just huge to have voice from all of the appropriate parties involved. So that completely, in lockstep with what Kelly said.
Thank you both for those insights. It looks like we have time for one more question. And Jessica, I think this would be a great one for you. So sort of on a similar topic, how would you approach a system that has operated a certain way for so long and maybe hesitant to change?
Sure. This is definitely a tough question, and it's a very real circumstance that I think both, the healthcare system, vendor-wise and provider-wise, face this all the time. So two specific approaches come to mind based on my experience. First being the use of data and analytics. When it's clearly backed up by the why, and by the why I mean how is it tying back to patient care and better outcomes, it becomes very difficult for the numbers to be overlooked. Something that strikes me is around specifically like central line dressing change kits. These can be very, very daunting programs and products to roll out, but when you're looking at implementing an SOP system-wide, and it ties back to reducing infection rates and ensuring that the clinicians are following the same process to provide the best possible care for the patient every single time, you will get buy-in across the board between, efficiency on the supply chain team, but then at the clinical level with those folks who do truly care about the best outcomes for their patients. The second part that I would put on this as it relates to this question is the start small approach that I mentioned earlier. When you feel like a standardization initiative is going to be met by, significant resistance, it is absolute best practice to try to, engage a small clinical team. And it doesn't have to be small in the sense of the number of people, but it can be as simple as, absolutely having the right people, sometimes executive level nursing staff, infection control, for example, the folks that are really going to champion the initiative and help drive it with their peers. Cannot speak highly enough to an approach on standardization, particularly where resistance is a concern. That's, hands down, a best demonstrated practice that I've seen.
Thank you for those insights, Jessica. And that's all the time we have for today. I want to thank Jessica and Kelly for their excellent presentation and Cardinal Health for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.